LT, you want to go ahead and flip the script here, and we'll talk a little to the doc here?
Yeah,
since he's
Dr.
already with
David
us?
Fieno, cardiologist, joins us. Everybody knows what's going on with Damar Hamlin. Still in stable or in critical condition right now. Dr. Fieno, we appreciate you coming on the next round. Were you watching when Damar Hamlin went down Monday night, and what were your initial thoughts?
Honored you guys would have me on the show. Yes, so the coincidences are incredible. I am actually from Cincinnati. I'm born and raised. And when I was studying cardiology at Cedars-Sinai during my training, I gave a presentation on commotio cordis. I was very concerned about the player because I always kind of take a big, deep breath when someone gets hit hard. But initially, I felt like there wasn't a big problem because he popped right up. When you watch the videos later, you see him collapse completely, and sort of as a doctor, you know that something is a lot more serious here. Where I became concerned was when the huge crowd of people came out and you saw that there was something serious that had happened.
It is. Initially, they had thought they had to revive him twice. Actually, now the family has said it was just once. I mean, obviously the medical personnel at the field, doc, saved his life. I mean, I don't think there's any other way to put it right now. He's still fighting for his life. He would not have had that fight in most other situations. I mean, that's one that would get you very, very quickly. Am I wrong about that?
You're 100% right. You know, one of the things that's difficult about this situation is that sometimes it's tricky recognizing a cardiac arrest versus a primary neurological arrest, like a seizure or being knocked unconscious. And having some familiarity with sports medicine, having the honor to work with Dr. Mike Patterson with the Birmingham Irons when they were here in town, that triage is absolutely critical. If a patient doesn't have a pulse, and if they are otherwise demonstrating symptoms that indicate their heart has stopped completely, starting CPR and early defibrillation is absolutely critical to their survival. There's no question that eventually got recognized. And I think a lot of what we're seeing is the recovery right now of stunned myocardium. So that means that there's been some injury to it. And hopefully we find out that the brain injury is the same way. Hopefully it's all reversible. And because he's so young and in such peak physical condition, we see a nice recovery. I think the 72 hours after the incident is going to tell us an awful lot.
Doc, we've had a lot of viewers who have started telling us personal stories. I was at a baseball game and a young man took a line drive back to the chest, or another football incident with a head to the chest, or, maybe even, just something on a playground and fall and hit the chest. How precarious is that hard blow to the chest, to the heart area? Is this something that you see frequently, or how rare is it?
Well, commotio cordis, which obviously is the buzzword right now in sports medicine, with this unfortunate young man's situation, it is something all doctors know about. I have a 15-year-old son who plays varsity football at John Carroll here in Birmingham. And I think every cardiologist, every doctor, every sports medical person is aware of the condition. It's all about timing. And depending on when that direct blow happens to the left side of the chest, or if the heart is displaced to the center or to the right of the chest, when that blow occurs in the setting of the cardiac cycle is what dictates whether the patient, the player, will go from a normal rhythm to a non-perfusing rhythm, either ventricular tachycardia or ventricular fibrillation. So it's both a matter of the nature of the strike, whether it's in football, there's an unfortunate practice called spearing, where a player will try to tackle them with their helmet directly to the chest. And that's where it's been documented. In baseball, with the obvious velocity of the ball with a hit or a strong throw, in karate and in the martial arts in MMA and in boxing. But unfortunately, it can happen with any sport. And when I do my pre-op physicals with my high school and grade school patients that I see, that I've had the honor of seeing over the last 13 years, commotio cordis is actually something I discuss with every one of my players because there's no way to mitigate that risk. There's quite a bit of talk right now about whether or not there may be other factors that are at play. But I unfortunately, I think this one was just timing was everything. And this young man got struck, with the shoulder pad of the other player. And it just happened at exactly that time.
So you do think, and we're talking to cardiologist Dr. David Fieno, just a couple of more moments here. Your expertise, it was the hit. It was not a pre-existing condition.
There's no way to tell for sure. You're definitely asking the right question, right? I tell people this all the time, and I haven't had a chance to examine this young man or talk to his family or talk to the doctors in Cincinnati. Obviously, that would be a HIPAA violation. But as a physician and seeing this, for at least the last 15 years, even longer than that, my best guess is that at the very least, the straw that broke the camel's back was the hit. Now, could there been a medley of things leading up to that, an underlying cardiac condition, some effect from a toxin, or God forbid, an ingested substance? There's some discussion of post-vaccine reactions, having a scar in the heart that would predispose somebody to a ventricular cardiac arrest like this. All I see is the train wreck. I don't know if a car went across the way, or if the train lost control, or what happened. I think right now, most everybody's thoughts and prayers are, including mine, are with this patient, with their team, with the family, with the doctors taking care of them bravely in Cincinnati. And, I think what's on his side right now is youth, and as you said, a superb group of medical personnel. And then it all really raises our awareness of just how dangerous these sports are, and how we have to really be cautious with direct hits to the chest of any kind.
Dr. Fieno, before you go, overnight the family said he was weaned from 100% oxygen to 50%. I view that as a very positive sign. Obviously, I do not have a medical degree. Is that as positive a sign as we want it to be?
Oh my gosh. Again, I haven't had a chance to talk to their doctors there in my hometown of Cincinnati. Obviously, like, if I were taking care of you, I would tell you, yes, I would like to see the oxygen requirements go from 100% to 50%. I understand they're doing prone ventilation right now too. That's where the patient is on their belly, and it allows the lungs to expand differently. The biggest thing we all have to be aware of is this young man's neurological prognosis. And what I mean by that is, was his brain damaged in the context of not having enough blood flow going to it and coming from it? And what we really need to be aware of and praying for is that there's a recovery of his neurological status, so that he can interact with us just the same way we're talking right now, so that he can tell us what he's feeling, and ultimately so that he can be back with his family, his friends, and ideally back even to playing. And then at that time, I think if I were involved in his care, I would initiate a full cardiac workup, including looking for some of these subtle things, scars in the heart, subtle arrhythmias, things like that. And I think what we're going to see in the next, I would say 48 to 72 hours is he starting to overbreathe the ventilator? For example, is he starting to trigger the ventilator on his own? That means that his neurological system, the reticular activating center in the back of the head, is starting to kick in. Is he starting to blink his eyes? Can he move his arms? Can he wince to pain? I think the pulmonary finding is great. I'm glad it's going in that direction. What I'm most interested in right now for this patient and for his family's sake is being able to give him that neurological prognosis.
Cardiologist Dr. David Fieno, great information. Really appreciate that. Good luck with the ping pong game. We hear you're a world championship player, ping pong.
Well, thank you so much, Ed. I really am honored to be on the show. Please call me anytime.
You got it. Thank you, Dr. Fieno. Take care. He was with us on the Johnston RV Center.com.
And that was
hotline.
brought to you by Precision Sports Medicine and Orthopedics. Great sponsor here, Dr. Michael Patterson. He mentioned him here. Got us hooked up with that interview.